to South First. I am Chetana Belgere, and today we are in conversation with Dr. A.S. Soin, India's top liver transplant surgeon with over 4,100 surgeries under his belt. We welcome you, sir. Sir, I understand that you're really active on Twitter also, but there has been quite a few discussions over Ayurveda and liver. I mean, there is a lot of talk about it. So being a renowned surgeon, I really need to ask you this. Does Ayurveda and the medicines which is consumed otherwise, the non-medical, I mean, the allopathy, other than the allopathy medicines, does that cause liver damage? Does it, I mean, has that been any of the causes for liver damage?
So the disclaimer here is I don't know enough about Ayurvedic medicine. I don't practice it. I don't recommend it. And if some patients come to me and say that they've been having Ayurvedic medicines and they continue to, along with my medicines, I said, absolute no, you have to choose between the two. So that's the first thing.
Okay.
Secondly, yes, I've had, so in our parlance, we call this CAM, complementary and alternative medicines. Okay. Mm-hmm. So CAM has been associated with liver failure in several instances. I have personally transplanted like several scores of patients, not several hundreds, but I would say 60, 70 patients have been transplanted over all these years who've suffered liver failure because of Ayurvedic or herbal medicine, clearly. That's the second thing I would say. So be very cautious, be very careful when somebody's having Ayurvedic medicines or herbal medicines. Third thing is not every prescription of herbal medicine and Ayurvedic medicine is bad. That is also not correct to say, right? So some of my colleagues are on Twitter, I'm sorry, bad-mouthing Ayurvedic medicine all the time. I'm not a subscriber of that group, for sure. Because there must be something, something good about it, right? So I already, my first disclaimer takes care of that. I don't know much about it, right? Okay. The only problem with Ayurvedic and herbal treatment is that they do not undergo rigorous clinical trials as our system of medicines do. So without that and without the science behind it, it's difficult to say if Ayurvedic doctor 1 is doing the same standard thing as 2 and 3. That is where the problem lies. So fly-by-night guys, so-called quacks, not everyone in Ayurvedic medicine is that, but I'm saying some of them will not know what they're doing and they're prescribing stuff which is harming patients. Yes. So I would definitely be careful in consuming these medicines, but I'm not saying that every prescription of Ayurvedic medicine is harmful. No, that's not true.
So liver diseases, including viral hepatitis, we've spoken about it, can have a significant impact on public health. So how do you think healthcare systems and governments can actually work together to increase awareness or improve screening? What can be done to reduce the burden of liver diseases amongst the population?
That's a very, very nice question. But unfortunately, I alone as a surgeon cannot answer it. So what happens is that your question actually contains the answers. So you have to increase public awareness about liver disease, about the causes of liver disease, and the fact that hepatitis B and C are completely treatable at early stages. Hepatitis B is also preventable by vaccination. Hepatitis C is also preventable by taking precautions. We already outlined the reasons for having this. AIDS, Hep C, Hep B happen in the same way, so prevention is known to everyone. So I think that the only other thing is that I would say that when you're talking about influencing national numbers and changing the mindset of society, individual doctors and hospitals cannot do it. It has to be a governmental and a non-governmental, like an NGO type effort. And of course, once they have policy, the hospitals and the doctors will help naturally. You know? For example, if there is a policy which says that every person entering every hospital must be vaccinated against hepatitis B, sure, our hospital can implement that. Not a problem. But I cannot go ahead and check everybody and say, you have to take hepatitis B vaccine. I cannot ensure that. I cannot enforce that. So public awareness and societal attitude changes and behavioral changes need a state push always, right? But then when there are laws and policies which have to be implemented at the hospital and the city level and the district level, sure, we all will contribute.
So what advice would you give to individuals who may be at the risk of developing liver diseases, or who have been diagnosed with a liver condition in terms of lifestyle changes, or what are some of the advices which you can give to both of these?
I think that 9 out of 10 people already know the advice: not take too much alcohol, ideally not take any at all. Control your weight, control your diet, regular exercise. When I say control your diet, means obviously avoid sweet food, avoid fried food, avoid processed food, avoid red meat, and the rest is good. High protein diet, whole fiber cereals, non-processed food. Not eating excessively, and so these are, and obviously enough. If you have to take oils, then you should take olive oil. If you have to take non-veg, you should take chicken and fish, white meat. Fish is particularly okay. And then, that kind of healthy diet and regular exercise. If you're diabetic, then control your diabetes well. If you're obese, then obviously you have to come down to a BMI of 28 or less, which means a good BMI is 23 to 25. So if you're 10% over, it's okay. But if you're more than 10% over, then you will be in the, overweight, mildly obese category, where the liver disease is very, very common. So these are some of the things that people can do. And like I already said, prevention of hepatitis B, C, universal hepatitis B vaccination. So these are the ways to prevent liver disease for society and for people to know that they can do it like that. In fact, 90% of the diseases of the liver are preventable.
The liver transplantation it has a profound impact on the entire family, both the donor as well as the receiver. So what kind of support do you think the families would need after the post-transplantation disease?
So I think that what happens is that, first of all, family support is extremely important, where behavioral changes, lifestyle changes are needed, because for example, people who take excessive alcohol and they have to come off alcohol, they need strong social support, right? Similarly, if there are families who have unhealthy eating habits within the entire family, not just the guy who had liver disease, but the others as well. So there has to be a change in the way that family lives, and specifically the diet routine has to be changed. So that's the other kind of support, and of course, then the other support is financial and logistic support. So a lot of people come from other cities, like you said, from the south to the north, and then they have relatives with whom they stay. So that's the support. And then a lot of people can't, they're on the fringes of being able to afford or not afford liver transplantation. So they need financial support.
It was wonderful talking to you. Is there anything which you think you should add to this?
No. I think this conversation has been very good, and you're very well informed, and you obviously read up or know already a lot about liver disease. So
thank you very much.
Thank you very much. Good to meet you. Good to talk to you.
Same here, sir.
Okay.
Thank
Bye-bye.
you very much.
Bye.